Today we're going to look beyond the office and look at providing point-of-care ultrasound imaging. Point of care is bringing the medical expertise and equipment to the patient's side. This varies dramatically from bringing the patient to a fixed piece of equipment in a hospital or doctor's office. Portable ultrasound is ideal for mobile medical imaging. The mobility of the imaging equipment, both size and weight, matter in portable imaging. Remember, we're providing point-of-care services in remote villages and even on the International Space Station. It appears we can provide point-of-care ultrasound services anywhere that people go, even outer space. Here on Earth, compact ultrasound systems, handheld devices, and wireless transducers that are compatible with a phone help clinicians quickly and confidently image internal organs and diagnose abnormalities in soft tissue, unencumbered by the cables or bulky cart systems that we used to use in the past. Point of care, bedside, focused, limited, and handheld are commonly used terms to modify the word ultrasound, although the term point of care ultrasound or POCUS has been widely adopted. This refers to the simultaneous acquisition and interpretation of ultrasound images at the patient's bedside by healthcare professionals to immediately inform, diagnose, or treat. As ultrasound technology and engineering has evolved, it has been demonstrated that it can be performed in a variety of pre-hospital settings, including stationary and moving vehicles, such as helicopters and ambulances. Ultrasound imaging is among the fastest, safest, and most universal diagnostic methods ever invented. Ultrasound instantly answers many clinical questions, shortening the assessment time and improving outcomes. With the advancement of ultrasound technology has come increased utilization and an increased number of exams that can be performed. In addition, its accessibility through its mobility has made it more available to patients around the world. Ultrasound services are being performed by many healthcare professionals, from the physician to the EMT. Newer trained physicians are as handy with ultrasound as they are with the stethoscope. It is a change from the day when only ultrasound was done by sonographers. Modern healthcare practices have the ultrasound equipment in the hands of many types of healthcare professionals. There is no federal regulation of ultrasound and its practice. Currently, New Mexico, Oregon, and North Dakota are the only states that regulate and license diagnostic medical sonographers. Most sonographers actually have certifications, and the certifications vary based upon the education and the skill level. There is no minimal threshold for education in sonography. Ultrasound is a diagnostic imaging tool that covers a wide range of tissue interfaces to be examined, and there are many types of ultrasound exams that can be performed. Point-of-care ultrasound exams only represent one portion of the scope of sonography being performed. To assure quality of health care given, we need to understand the different certifications and the minimal requirements for both expertise and education to receive those certifications. Remember, there is no federal licensure for sonography, and only 3 states have licensure requirement. Expertise, including both knowledge and practical skills, vary widely among sonographers. It would be beneficial if a standardized minimal level of skill and expertise was recognized at the federal government level and the state level. So let's look at existing training and certification. For physicians, there are specialty certifications. You must satisfy experience requirement for each component related to your certification. Physicians must be mentored and tested, as well as proctored through doing examinations to get certifications. There are different boards of certification, one of which is the ARDMS, the American Registry of Diagnostic Medical Sonographers, that provides certification for healthcare professionals. These certifying boards are designed for non-physician healthcare providers, but physicians also take this training to get more in-depth training on ultrasound and the certification that goes with that training. Physicians can hold any number of sonography certifications. The use of ultrasound as a tool is used by more than physicians and sonographers. Other healthcare providers may utilize ultrasound to get a diagnosis and help in treatment. Ultrasound or sonography is used by many healthcare professionals. Training in ultrasound provides an experienced user the ability of rapidly ruling out or ruling in certain key diagnoses immediately at the patient's bedside. There are a number of healthcare professionals that utilize ultrasound, as we discussed, from the EMT to the nurse to the healthcare professional to the nurse practitioner and midwife. These healthcare professionals have training and expertise different from both the sonographer and the physician that reflects their role in healthcare. Ultrasound is a hands-on diagnostic tool for these healthcare professionals at the patient's bedside. It helps these healthcare professionals to diagnose, triage, and treat patients when there is no sonographer or physician available. In the past, physicians relied heavily on the radiologist and the sonographer to provide information, but this caused a delay in treatment. Today, many physicians are learning ultrasound in school as they're learning their healthcare skills. Utilizing ultrasonography as part of their practice, the physicians are more rapidly able to provide healthcare and treatment to the patient. This practice allows physicians to better provide services, whether in the emergency room, surgery, or at a specialty clinic. Registered Diagnostic Medical Sonographers, the RDMS credential, raises the standard of diagnostic medical ultrasound practice worldwide and promotes the best practices for enhanced patient safety. It would be good to have universal standards and protocols worldwide for ultrasound examinations. The American Registry for Diagnostic Medical Sonography is the internationally recognized standard of excellence. Here we see the Registered Diagnostic Medical Sonographer certification and some of the specialties, such as the Registered Vascular Technologist and Registered Diagnostic Cardiac Sonographer. As shown here, we even have more certifications that you can earn dependent upon your practice and your specialty. Here is a list of the major certifications that are available from the RDMS. There are sonography certifications for the other types of healthcare providers, such as the Midwife Sonography Certificate. The Midwife Sonography examination assesses the knowledge, skills, and abilities in the areas of female reproductive systems, as well as the fetus in the first, second, and third trimesters of pregnancy. As we discussed, many medical specialties now include training in ultrasound procedures in their residency and fellowship programs, which allows physicians to perform real-time exams in their offices or at the patient's bedside. Several medical schools in the United States are offering ultrasound training as early as the first year, even in orientation programs. Ultrasound is used in classes of anatomy, physiology, and physical diagnosis, and eventually on clinical rotations. We find that point-of-care ultrasound with course durations for physicians and paramedics, ranging from a half day to a full day, are adequate to teach both image acquisition and interpretation. Obviously, the more the physicians and paramedics utilize sonography, the better their skills become. Non-physician EMTs have been successfully trained to execute pre-hospital ultrasound to assess for pneumothorax, pericardial effusion, and the presence or absence of cardiac activity. These courses, of course, do not teach ultrasound, but just the application of ultrasound for a particular procedure. Hands-on clinical application of ultrasound does not require an in-depth knowledge of the physics of ultrasound. Physics and more in-depth courses are provided to students seeking the ARDMS certifications. Clinical hands-on training is used to demonstrate how to acquire a good quality image and to interpret that image. Modern technology has simplified the equipment and made many of the technical adjustments transparent to the user. This modern technology allows the healthcare professional to concentrate on the patient and the interpretation of the images that they are acquiring, and not the technical adjustments. Modern equipment actually automates many of the things that we used to do manually in operating the equipment. Let's now focus and discuss point-of-care ultrasonography. Point-of-care allows us to transport ultrasound equipment to remote villages where we can perform exams on patients, to the International Space Station, to the field of combat, and to the site of natural and man-made disasters. Bringing the equipment to the patient allows us to get the right person to the right place at the right time with the right modality and expertise, be they physician or non-physician healthcare provider. Point-of-care imaging is utilized in disasters, trauma, remote imaging, and at the clinic and office and hospital. We have point of care, and we also have point of time. Point of time allows us to triage patients on site, evaluate the patients on site and diagnose them, and possibly treat or evacuate the patients as needed. POCUS, or point of care ultrasound, is the solution to mobility.